Fetal circulation. Fetal circulation is a little bit confusing, but if you can understand the concept, it is very easy. We will see fetal circulation before birth. Before going to explain this fetal circulation, we will just check this diagram. Here you can see umbilical cord. This is the umbilical cord. Here will be the placenta and this is the umbilical cord. Umbilical cord contains two umbilical artery and one umbilical vein. It is important. Umbilical cord contains one umbilical vein and two umbilical artery. This umbilical vein carry oxygenated blood. Very important. Umbilical vein carry oxygenated blood and umbilical artery bring deoxygenated blood. Okay, so I told this is the umbilical cord, and inside umbilical cord you can see umbilical vein and umbilical artery. Leave it. Here you can see inferior vena cava. See the cursor is going inferior vena cava going to the heart. Inferior vena cava. Leave all this diagram. You just watch only the inferior vena cava. See, this is the inferior vena cava. You can see here heart, here right atrium, right ventricle, left atrium, left ventricle. You can see pulmonary artery is going, and this is the aorta. You can see the aorta, and you can see here lungs. Before understanding this concept or before watching this video, it will be better if you can see the normal blood circulation in the heart or normal physiology of the heart. Okay, now we will start. Normally, from the umbilical cord, here the umbilical cord or the placenta, from the placenta or from the mother, the umbilical vein bring oxygenated blood. You can see here oxygenated blood is going. Oxygenated blood will go, and this oxygenated blood actually, or the umbilical vein bringing the oxygenated blood to the liver. This is the liver. So umbilical vein is bringing oxygenated blood to the liver. But at the same time, see here you can see the umbilical vein going into the liver, and from here you can see, you see one branch. And this umbilical vein is connecting to the inferior vena cava. This is the inferior vena cava. You can see this is the inferior vena cava, and this is the umbilical vein. So when umbilical vein go through the liver, it is connecting to the inferior vena cava. See, umbilical vein is connecting to the inferior vena cava. This part is called ductus venosus. So ductus venosus is the shortcut which is connecting inferior vena cava and the umbilical vein. Ductus venosus is the shortcut which is connecting the umbilical vein and inferior vena cava. So here oxygenated blood from umbilical vein is through the ductus venosus. Through the shortcut, it will go to the inferior vena cava, and from inferior vena cava, this blood is now in the, you can see in the right atrium. Now it is here in the right atrium. Leave the color and everything. Just think that it is in the right atrium. Keep in your mind it is in the right atrium. So normally when blood comes to right atrium, it will go to the right ventricle. See, this is the right ventricle. So from right, leave all this arrow, everything, just understand or hear what I am saying. From right atrium, the blood will go normally to the right ventricle. But here what normally from right atrium it will go to the right ventricle, and from right ventricle it will go to the pulmonary artery and to the lung. I am telling the normal physiology. Right atrium, right ventricle, and from right ventricle it will go to pulmonary artery and to the lung. But in baby the lung is not working because the baby is not breathing, so the lung is not working. So automatically if the lung is not working, there will not be any oxygen, so the resistance or the pressure inside the lung will be more. Understand? The pressure inside the lung will be more because the lung of the baby is not working. So when there is a pressure, when the pressure is more in a lung, automatically the pressure you can see in the pulmonary artery. You can see the pressure in the pulmonary artery. So when the pressure is more in the pulmonary artery, the pressure is automatically you can see in the right ventricle. I am telling again, normally blood will go from right atrium to right ventricle, and right ventricle to pulmonary artery, and from pulmonary artery it will go to lung. But in baby, because the pressure in the lung is more, this pressure you can see all along the way in the pulmonary artery and in the right ventricle. So here the pressure is more, so automatically what will happen, from right atrium the blood will directly go to the left atrium through a hole. This hole is called as foramen ovale. So foramen ovale means from a right atrium the blood is directly going to the left atrium. From right atrium the blood is directly going through a hole to left atrium. So the hole is called foramen ovale. Why there is a hole? Because the pressure inside right ventricle is more, so this pressure will cause opening of a hole between right atrium and left atrium. So this is called foramen ovale. So what is happening here? Normally blood which is coming from inferior vena cava into the right atrium will not go, means almost it will not go whole blood, it will not go to right ventricle. Majority of the blood will go to the left atrium. From right atrium it will go to the left atrium. Only small amount of blood will go to the right ventricle because the pressure here is more. So the blood will go from here to right atrium to left atrium. Understand? And as I told, the pulmonary artery pressure is more. The pulmonary artery pressure is more. I told that a minimum amount or a less amount of blood is coming to the right ventricle, and from right ventricle this less amount of blood is going through the pulmonary artery. Not majority blood, a less amount blood is going through this pulmonary artery. So because of the high pressure, there will be another connection between pulmonary artery and aorta. There will be another connection between pulmonary artery and aorta. This connection is called as ductus arteriosus. So I will repeat. The first one I told ductus venosus because the shortcut from between umbilical vein to the inferior vena cava. It is also vein, vena cava. So this shortcut is known as ductus venosus. Here I told another shortcut between pulmonary artery and aorta. So this shortcut is known as ductus arteriosus. Pulmonary artery and aorta artery. So ductus arteriosus. Then another opening I told between right atrium and left atrium there is an opening. It is called foramen ovale. Why this opening is occurred here means I told that as the baby's lung is not working, the pressure inside the lung will be more. So automatically the pulmonary artery pressure also will be more. If the pulmonary artery pressure is more, automatically the right ventricle pressure also will be more, because it is all connected. If the right ventricle pressure is more, so blood cannot go from right atrium to right ventricle. A minimum amount of blood will go, but majority of blood cannot come here, so it will make a opening from right atrium to the left atrium. This is called foramen ovale. And the minimum amount of blood which is coming here in this right ventricle will go to pulmonary artery, but because of the pressure here, it will make another connection between the aorta. This is called ductus arteriosus. So from aorta it will come, the blood will come to the descending aorta, and all along the body it will travel, and through umbilical artery it will go to the umbilical cord. So through umbilical vein blood came, and through umbilical artery blood is going. So here the important point, three things: ductus venosus, foramen ovale, ductus arteriosus. Ductus venosus means umbilical vein making a shortcut with the inferior vena cava, that is ductus venosus. Foramen ovale means it is a opening you can see between right atrium and left atrium, that is foramen ovale. Then ductus arteriosus is the connection between pulmonary artery and aorta. Otherwise the blood, if you see the blood flow from right atrium, blood will go to the left atrium, then left atrium it will come to the left ventricle, and through aorta it will go to descending aorta, and it will go to umbilical artery, and it will reach the placenta. So this is what happening before birth. After birth, what will happen? After birth the baby start to breathe. After birth baby start to breathe. So when baby will start to breathe, the pressure inside the lung will decrease. So the pressure inside the lung will decrease. Automatically the pressure inside the pulmonary artery also will decrease, and the pressure inside the right ventricle will also decrease. So when the pressure inside the right ventricle decrease, the blood from the right atrium can easily come here. The blood from the right atrium can easily come here. Forget all this arrow mark here. I will explain again. When the baby start to breathe, the pressure inside the lung is decreased. So automatically the pulmonary artery pressure also will decrease, and as the pulmonary artery is connected to the right ventricle, so the pressure inside the right ventricle also will decrease. So when the pressure inside the right ventricle is decreasing, easily blood from right atrium can come to right ventricle through the tricuspid valve. So automatically the opening or the hole between right atrium and left atrium, before I told it was foramen ovale, this foramen ovale will close. The foramen ovale will close, and now the after closing, the foramen ovale is called as fossa ovalis. Before it was called foramen ovale. When the foramen ovale is closed, it is called fossa ovalis. So now you may be understood how the foramen ovale is closing. Simple, because the pressure inside the lung is decreasing, then pulmonary artery pressure is decreasing, right ventricle pressure is decreasing, so automatically blood will come to right ventricle. It will not go to left atrium, it will come to right ventricle. So this pressure, this hole will be closed. And another thing, as I told, the pressure inside the pulmonary artery is decreasing. The connection between pulmonary artery and aorta, before I told there is a connection between pulmonary artery and aorta, because the pulmonary artery pressure was more before, that is why there was a connection between pulmonary artery and aorta, which is called ductus arteriosus. Now the pressure inside the pulmonary artery decreases, so this also will close, and this will now known as ligamentum arteriosum. Before it was ductus arteriosus, now it is ligamentum arteriosus. So this is what happening here. Let's see what happened to ductus venosus. What was ductus venosus? Ductus venosus means shortcut between umbilical vein and inferior vena cava. Now the placenta sorry, the umbilical cord, we will clamp after the birth of the baby. We will clamp this umbilical cord, so no more blood is going to or going through umbilical vein to the inferior vena cava. No more blood will pass through umbilical vein to inferior vena cava, because we will clamp after birth. We will clamp this area, so no more blood is going. Then automatically this opening or this shortcut or bypass will be closed. So before it was called as a ductus venosus, now it will called ligamentum venosus. So after birth, the ductus venosus will change to ligamentum venosus. Foramen ovale. Foramen ovale means it was the opening between the right atrium and left atrium, and now it will close and it will become fossa ovalis. And ductus arteriosus. Ductus arteriosus was the shortcut or the connection between pulmonary artery and aorta. Now it will be closed and it will known as ligamentum arteriosus. So these are the some of the changes you can see in the fetal circulation before birth and after birth. For exam, normally they will ask number of umbilical artery present in umbilical cord, a number of vein present in the umbilical cord, what type of blood. Umbilical artery brings deoxygenated and umbilical vein bring oxygenated blood, and the connections, as I told, ductus venosus, foramen ovale, ductus arteriosus, all these connections they may ask. So if you found any difficulty to understand, or if you feel confusing, just pause this video and hear this video again and again. Leave all these arrow marks show here. Just focus what I am telling. If you can understand the concept, then it will be very easy topic for you. Thank you.